Hello and welcome to Talking Pharmaceuticals, an interview series brought to you by Making Pharmaceuticals and Distributing Pharmaceuticals. I'm Victoria Emerton, Conference Director for the events which next take place in April 2025. And in the lead up, I'll be joined by experts from UK Pharma to share insights, opinions and practical advice, providing a fresh perspective on key challenges and opportunities in the industry and to look ahead to their involvement in the events. Today, I'm delighted to be joined by Dr. Iain Moore, Senior Advisor at EXCiPACT. Iain, thank you very much for your time in talking to me today.
You're welcome. I'm delighted to be here.
Thank you very much. And you've been involved through EXCiPACT with Making Pharmaceuticals for many years, actually. We're in year 11 now, and I think I've seen you at pretty much every event. So yeah, delighted to be talking to you today.
Yeah,
so we're going to cover a little a sort of snippet of what EXCiPACT will be delivering at the conference at Making Pharmaceuticals. So for those who don't know, what is EXCiPACT certification?
Well, great question. Thank you, Victoria. EXCiPACT certification is designed to be a trustworthy and reliable alternative to customer audits of excipient suppliers. So experts from around the globe, including excipient suppliers and pharmaceutical companies, developed EXCiPACT with the express intent of permitting objective and consistent audits anywhere in the world. And the standards are developed from the well-known IPEC, PQG and GMP and GDP standards, and they've been kept fully aligned with those ever since. And latterly, and as a result of the successful adoption of EXCiPACT certification, standards have also been amended to allow certification of warehouses holding excipients, or good warehousing practice, as we call it. Altogether, that combination of GMP, GDP, and now GWP, or otherwise known as GXP, provides an unparalleled scope to maximise confidence that excipients are safe and secure along the entire supply chain. The other factor in the standards is that their risk-based approach means they're very adaptive, and that can be accommodated in the audits. This approach has been so successful that we've actually been able to develop and apply EXCiPACT GMP to materials we call pharmaceutical auxiliary materials, or PAMs for short. Typically, these are things like cell culture media, ion exchange resins, and so on, which are used in biopharmaceutical production, but are then removed before being formulated into drug products. And there are now several PAMs manufacturers holding EXCiPACT certificates to show they've applied good standards of GMP in the manufacture of these materials. I mentioned briefly that EXCiPACT itself is a not-for-profit organisation legally based in and registered in Belgium, and we manage the oversight of all aspects of the certification scheme. The members of EXCiPACT are also associations, and that ensures no one company or other vested party can dominate the overall mission and vision of EXCiPACT. For us, patient safety is always first.
Fantastic. So it sounds like something anyone involved in excipients should be involved in themselves and most certainly be aware of. So how could I get certified if I'm not already?
Yeah, well, we have qualified international third-party certification bodies to provide the auditors and the audits to the EXCiPACT GXP standards. And they do have to use the EXCiPACT qualified auditors to do that as well. As an excipient supplier, you would have to select one of those approved certification bodies from our website, contact them, there's a link through from the website to do that, and get a quote. And then the process is exactly the same as the traditional ISO certification processes as used for ISO 9001 or for medical devices, ISO 13485. Certificates are then valid for 3 years following the initial full certification audit, which has to be in person and on site. And that's followed by 2 on-site annual surveillance audits. After that, the cycle completes and repeats again on a 3-year basis. If there are no major non-conformities with the first certification audit, then congratulations, you can have a certificate. And then once you're certified, you supply that and the audit reports that the auditors write with your customers. And there's no third party holding those audit reports. It's just a simple relationship between you and your customers, one-to-one, with no one else involved.
Fantastic. So I'm a customer of a company that has EXCiPACT certification. How can I use my supplier's EXCiPACT certification?
Yeah, the other side of the coin. That's great. Well, regulators, of course, require the excipient users, the drug product manufacturers, to qualify their suppliers based on GMP, GDP audits. And they've indicated that third-party auditing of suppliers is acceptable if a credible certification body issues certificates and there are audits done by qualified auditors. And that's what we've ensured in EXCiPACT, that the auditors are credible, they understand our GMP, GDP standards, and they have to go through an exam following a training course before they can start audits. So we meet all of those requirements from the regulators. And of course, in Europe at least, excipient users are also required to back this up with something called the formalised risk assessment to ascertain GMP for excipients. Bit of a mouthful, but a very powerful piece of guidance. And what you do is to take the excipient in the drug product, you evaluate its function and purpose and threats to patient safety. You look at how that excipient comes to you as a drug product manufacturer, so the supply chain risks, and you merge those together in an overall risk assessment to determine what quality excipient you want, so the substance itself, but also what GMP you require. And like everything in pharma, if you predefine a hierarchy of GMPs and you've put EXCiPACT in that list, fantastic. And then if your supplier comes along and meets or exceeds your GMP, and it happens to be EXCiPACT that they've got, then all the boxes are ticked and everything's lined up. And at least that part of the supplier qualification is ticked off. You've defined the GMP you want, the supplier's demonstrated that they've got it, and you can utilize EXCiPACT certification in that manner to approve your suppliers.
So why can I trust EXCiPACT certification? What sort of layers of trust building do you have? Why is it a great scheme?
Well, that was one of the things that we designed, to answer fundamentally in the original design of the EXCiPACT certification scheme. We're well aware of the vulnerabilities in the ISO certification process. And so we tackled them head on. So every certification body that offers EXCiPACT certification has to be qualified by us. And that includes a legal agreement to make sure they implement the scheme rules in accordance with best practice in certification. That's another ISO standard called ISO 17021-1. We actually physically audit them on their premises every 3 years to make sure that they've adopted that, and we have at least annual meetings with them to stay in touch and make sure everything's working properly. The other thing that's core to the certification process, it's not the auditor that makes the certification decision. They can only recommend you for certification after completing an audit. It's a second person back in the certification body, reviews everything, make sure all the boxes, all the bases have been covered. The audit report is comprehensive. If there are any questions, they will ask the auditor, and it's them that then makes the decision. All the auditors, as I said, have to be qualified. They attend an in-person 2-day training course. Even during lockdown, we had them in person, or we just didn't run the courses because we weren't prepared to compromise the quality of those training courses. They have to pass an exam, and not only that, but on their first EXCiPACT audit, they have to be witnessed by another EXCiPACT auditor to make sure that they've implemented what they've learned in the training courses. And indeed, this last year, we've also taken that witnessing to another level where EXCiPACT consultants go and witness EXCiPACT auditors fully independently, and that's something EXCiPACT funds independently of the certification bodies to make sure there's true independence and objectivity in assessing the performance of the auditors. One of the other key things, reasons you can trust EXCiPACT is the fact that it's a combination of ISO 9001 and GMP, GDP. ISO 9001 is a very good quality management system. It's very fundamental. It's applied throughout the world. But by building GMP on top of it, and I liken that to 2 blocks of Lego stacking together, clicking together, you fuse together not only GMP compliance, but also a very good quality management system. And indeed, that's exactly where the FDA wants the industry to go, having defined a mature quality management system in recent guidance. Finally, of course, EXCiPACT is, as I mentioned, a fully independent organisation with members who are themselves associations. And this gives it unique freedom from conflicts of interest. So no one company has excessive influence, no one person does either. And as I said earlier, our focus very much then is on making sure everything's safe for the patient. I'd like to finalize this little section, if you like, by saying we always recommend that if you do have an EXCiPACT certificate, then you have to go to the EXCiPACT website and check on its validity. So there are three things that you can check there. Is the CB approved by EXCiPACT? Is it listed? Is the auditor listed? And is the certificate holder listed? If you've got three yeses there, yes, you're in the final.
Fantastic. It sounds like an incredibly robust process with many fail-safe steps built in. Is certification approved? I'm sure lots of people are wondering that. Approval is crucial in lots of sectors, and pharmaceuticals is certainly one of them. So is there approval for your certification system?
I don't think the regulators can really approve it at EXCiPACT or a similar scheme, because that could kind of make it mandatory. And that's not always in the best interests, I think, of everyone. However, they've been kept fully informed throughout its development, and we're now in the middle of a process of going to the regulators again after being in existence for 12 years, nearly as long as making pharmaceuticals.
Yes.
We're seeking their feedback, because they will have seen users and suppliers using EXCiPACT certification extensively. However, both the United States Pharmacopoeia and the European Pharmacopoeia have recently stated that EXCiPACT is a suitable GMP to apply to excipients and to define the GMP for excipients when they receive submissions. So you can apply to the USP for the USP verification of excipient scheme. Part of that is you have to have GMP, and you have to have a GMP audit. And USP have said, well, you can use your EXCiPACT audit report for that purpose. And then it's just a question of having samples tested by the USP to get USP verification status. And EDQM also has certificates of suitability against the monographs of the European Pharmacopoeia. And that's a similar process where you submit a dossier, a bit like a drug master file, and you have to demonstrate GMP that you've implemented that for your excipient. And they've said, yeah, put the EXCiPACT in there, put the audit reports in there, that we know what that is. We're comfortable with that. So I think that's probably as formally qualified and as approved as we can get in the industry. That the compendia are very comfortable with where we're at and what we've been delivering. And of course, with 200 sites around the world now holding EXCiPACT certification, more and more suppliers generating value from them, and the customers too. I think that's its own story about, is it approved? I think, yes, people are comfortable with it and they're using it. And of course, there's really never been a better time now than to obtain, use and trust EXCiPACT certification.
It certainly appears to be trusted and implemented, and if in 12 years you've been adopted in 200 sites globally, I think that's a testament in itself, isn't it? It's fantastic, and it's been nice to be involved with EXCiPACT, as you say, for pretty much as long as our event has been running. So EXCiPACT will be presenting in the conference in April. There are two presentations, one called New Ways EXCiPACT Certification Adds Value, and the second one is The Changing Nature of Excipients, How Existing Guidance is Still Valid. The programme is on the event website. People can go and have a look at that, find out what else is going on. EXCiPACT are also exhibiting on stand number 827 with IPEC Europe. You normally pair up, so there'll always be someone around while EXCiPACT is speaking, and IPEC indeed as well are presenting, if anyone wants to come along and have a chat about what you do and how you can help them. I
look forward to meeting everybody there again, although sadly I won't be there in person this year, but I will be there in spirit.
I'm sure you will, and we'll miss you. Actually, you are a very regular and familiar face at the event, Iain. So just to remind everybody watching that attending the exhibition and conference is free. Registration is open at www.makingpharma.com, and we look forward to seeing your colleagues, if not you this year, Iain, and everybody watching this podcast at the Coventry Building Society Arena on the 29th and 30th of April. Thank you very much for your time.
You're very welcome. Thank you. Take care, everyone.